Coming up on this podcast, the unusual places you can put CBD oil on your body. Yes, that's coming up in a few moments' time. Also, we look at long COVID, histamine intolerance, and fish. Hi, I'm Tony. I'm an author, presenter at Sky Sports, and years ago I went to the jungle and got ill. Very ill. So this is my podcast adventure to find more energy. It's packed with biohacking, science, health tech, supplements, and some of the most well-known experts on the planet.
This is something I spent 4 months of my life doing with electrodes glued to my head so that you can do a lifetime worth of meditation.
Decide what you don't give a fuck about, which is something you don't care about.
Some of it gets quite out there.
I had some stem cells sent up to my house that I had stored, and then I injected myself with mannitol.
And we even hack hangovers.
Alcohol is poisonous. So is water and oxygen in the wrong dosage.
So that's my podcast, Zestology. Live life with energy, vitality, and motivation. Welcome back to Zestology. I hope things are going well for you. Hope you have had a good previous 7 days or so. Been getting very into CBD oil. It's taken me a long time to jump on the CBD bandwagon, but I have now. I suppose I like anything that can give me a slightly altered state, and that's why I don't really drink anymore. I'm very boring, don't drink alcohol much. And that's probably partly down to the histamine intolerance, which we'll talk about on today's podcast. But I'd still quite like to sort of feel a bit different and to take the edge off, quote, take the edge off in the evenings. And that's why I've been interested in CBD for a while. I tend to take it in drops under the tongue. Also gummies or drops. And I've got to say, it doesn't really provide that altered state, but it does sort of take the edge off a little bit. And I think it might help with sleep as well. And if I take around 25 milligrams or more, I do feel pretty good on it. I think the recommended dose is probably a little bit less than 25 milligrams, but I'd be interested to know anyone else's opinions on taking CBD, when you take it and what you take it for and whether you think it helps. I know a lot of people take it for a pain reliever as well, but I'd just be interested to see if you have found that CBD helps. The reason for bringing up CBD is that I met with a former podcast guest on Zestology the other day. And I'm not going to say who it was, but this former Zestology podcast guest has told me that he or she, let's call them they, has got very into CBD oil, and their favourite way of taking CBD is either a vape or, and this is their number one recommendation, suppositories. I can't quite work out how that works, but apparently CBD taken that way works extremely well. So I'm not going to dwell on that on this week's Zestology, but just to let you know, there are different ways of taking CBD. On to today's podcast then. Let's move on very swiftly, shall we? Because Dr. Tina Peers is someone I've wanted to interview for a very long time. She's a specialist in the menopause, long COVID, histamine intolerance, hormone health, and reproductive health. And I just found this podcast so interesting. In this podcast, we look at, firstly, the link between long COVID and histamine intolerance. We look at the link between histamine intolerance and fish, which I think you'll find interesting. She has a special interest and experience in treating mast cell activation and histamine intolerance. And the story of what her daughter went through is an incredible tale. Her daughter had angina at the age of 7. And for more, you will want to listen to this podcast. And now she's developing an interest in helping patients with long COVID, which is amazing as well. She's a brilliant podcast guest. And I think, obviously, I'm originally interested in histamine intolerance. You would have heard me talk about that before on this podcast. But now to find such an expert and somebody who is helping so many people particularly with long COVID. And I've had a lot of people get in touch with me about long COVID fairly recently. The fact that she's helping so many people is spectacular. So here she is on Zestology. Welcome, Dr. Tina, to Zestology. Thank you for coming on.
It's a great pleasure. Thank you so much for inviting me.
Yeah, really been looking forward to talking to you. I've definitely read quite a bit of your work online before. And the reason that I set up this interview is because you posted a video on YouTube that's been watched a lot of times about histamine intolerance and long COVID, which is something that's increasingly coming up. Well, I was fascinated. I hoovered up that 18-minute video because I've had histamine intolerance for about 25 years, but I only really discovered it a couple of years ago. And it's made the biggest difference to my life to sort of change it and make tweaks. And I thought, here's someone who understands the condition. And you really do, don't you?
Well, I do. And the reason I've developed the interest in histamine intolerance is because of my youngest daughter, which I don't know if it was mentioned in that video that you maybe saw, but my youngest daughter is 28, and from a very small child, she always had ill health, and she had terrible eczema, but there was always more going on than just eczema. We kept being told, oh, she's just allergic, she'll grow out of it, it's fine. But I knew there was something else going on. And she had some very strange symptoms, and including angina at the age of 7. So she was getting chest pain at the age of 7, which we had fully investigated. And her heart, of course, was completely normal and fine. But it was obviously angina from her description of what was going on. And now I know there's something called Cohen's disease, which is constriction of the coronary arteries when there's no obstruction. So there's nothing to cause the angina apart from high histamine. So she was having these experiences and experiencing these symptoms when she had a high histamine in her body. We didn't know anything about it in those days. It was a long time ago. And there was nothing known about histamine intolerance. And she had severe infection at the age of 16 with swine flu. And after that, her health never really picked up again. And she just had the eczema was worse, headaches, a lethargy, would have been diagnosed as ME really at that point. And I just knew something was going on with her, but I couldn't work out what it was. And one of my work colleagues actually said to me, oh, have you heard of histamine intolerance? And I looked it up on the internet and there was nothing about it. So I just sort of parked it at the back of my head. And then when she was 19, she got terrible. When she was 16 and had the swine flu, she became hypothyroid as a result of the inflammation caused by the way her mast cells reacted to the swine flu. And then at 19, she had chickenpox. So she was again very ill. And again, she never quite recovered her health to the previous level, which was never great. And then when she was, when in 2016, I can't even work out how old she was then, a few years ago, 5 years ago, 6 years ago, so she's 22, she decided enough was enough and she was going to bullet superfoods and go on a health kick, exercising like crazy, bulleting all this fantastic food. And of course, what she was doing was poisoning herself with high histamine foods. Yeah. So it was the tomatoes and spinach and avocados and all of those things, which are healthy, but they're not healthy if you can't metabolize the histamine away. Yeah. And she just made herself progressively iller and iller.
I bet she was making smoothies with avocados and spinach and things that were great.
Yeah, she was. And she was downing it like there was no tomorrow, and she thought initially she had caught flu, but then she had every single symptom you can imagine that goes with high histamine. So she was having fainting, terrible dizziness, would wake up in the middle of the night with nausea, rush to the bathroom, not be sick, terrible IBS, swollen face. And one morning she woke up and her face was like a football with the swelling, and her lips were so broken and swollen she could hardly even drink any water. It was awful. And that's when we made the diagnosis. She rang me up in tears and said, I can't touch my skin, it's so painful, I don't know what's going on with me, I feel so ill. She wasn't living at home at that time, so I hadn't sort of noticed this deterioration in her. And I rushed over and got her, brought her home. And then actually it was my husband who said, gosh, it's like she's reacting to everything. It's like histamine. And it's when he said histamine, I then looked up histamine intolerance again. And of course, this was, 9 years later, and there was quite a lot of information. And then that's when I made the diagnosis and said, right, she's got histamine intolerance. So that's where my interest developed, really. And since then, it's, you can't unlearn something, can you? So once you know about something, I kept seeing it. So I was doing contraception clinics. I was in charge of sexual health clinics in Surrey, and I was seeing lots of women for contraception and Mirenas and things. And I would make the diagnosis that they had histamine problems when I was calling their name in the waiting room. I could see there was a sort of look on their faces. There was a sort of tone to their skin.
Really?
And I would, So I then asked them about their general health, as you should, taking a proper history. And I'd say, I think I might know what's going on with you. And they would mostly burst into tears, actually, because they would be, first of all, slightly surprised that a doctor was interested in all of their symptoms affecting all of their systems, not just the gynae or the gut or I would ask them about everything. And then I would say, I think I know what all these symptoms are being caused by. And they would literally have been struggling for decades. Yeah. And to have an answer was just so helpful, I think. So that's me, really.
It's just extraordinary to me, though, that there is so little. I mean, it is clear that a lot of people are suffering from it. And, that sort of mirrors my experience. From the age of, I can't really remember, but definitely a teenager, every once in a while I'd have dreadful stomach issues and couldn't explain why, especially if I had too much to drink the night before, but in general as well. And then heard about this concept of histamine intolerance, a lot, and it sounded confusing. There wasn't much information out there, struggled to really get my head around it. And when I actually embarked upon eating low histamine for 3 days, along with taking a few supplements like vitamin C and quercetin, I felt better within about an hour.
Amazing.
And I haven't felt as bad as that since.
Fantastic.
It is. It's amazing. And so I think it's difficult because, as you said, there's not many histamine intolerance experts out there. And certainly I've not got a medical background, but I'm a journalist and I'm very committed to sort of bringing this information to more people. And I'm loving doing that. But I think it's difficult because even for you, I mean, you were saying before we started recording, you are a doctor and you're a medical specialist, but you're not an immunologist, are you? So it's quite hard because these things are very hard to get the right information from people.
It is. And sometimes I think when I write to the GPs of my patients and say, I think they've got histamine intolerance, maybe some mast cell activation going on and so on, because so little is known in the medical profession about it generally, there's a bit of pushback sometimes. They think, who's this woman? Why is she saying this? And how is she making this diagnosis? And often it's something they've never even actually heard of. Yeah. When I was at medical school, we had probably half an hour on histamine and mast cells, and I remember the lecture. I remember I went to Guy's and I was sitting in this wonderful lecture theatre, and this professor said, mast cells, they're responsible for allergic responses and for some of the immunity. And there's something called mastocytosis where there are some really abnormal mast cells, but you're never going to see one in your whole lifetime. It's so rare. And that's when the mast cells can become cancerous. And you just, you're not going to know about it, but don't worry. But it also is involved, mast cells are involved in some allergies. And I remember thinking, well, if I'm not going to see one in my whole life, and you just immediately forget about mast cells because you've got so much else to remember and to think about. But actually, the mast cells are everywhere. They're in every single tissue. They respond to chemicals and to infections and things. They are our first line of defense in our immune system. And if you have the kind of mast cells that overreact and become a bit too vigilant, then that can be miserable because it gives you symptoms resulting from all the chemicals that they release, which cause inflammation and lots and lots of symptoms all the time.
Yeah. How's your daughter doing now?
She's fantastic.
Great.
She's fantastic.
That's brilliant. It
took us a long time initially I made the diagnosis and I couldn't find any doctors to help us. And we saw a professor of immunology and allergies who literally turned to me in the consultation with her there and said, I think she's got a brain tumor. because he didn't know anything about it, and yet he was seeing people with eczema and all these problems all the time. That was horrendous, because she obviously did not have a brain tumor.
No.
And, but he just hadn't even heard of the condition. And we saw a professor of dermatology, again, who wanted to give her some quite strong, nasty drugs, and hadn't heard of the condition. But eventually, I found Professor Vic Kular at St Mary's Paddington, who is he's a urogynecologist. And because he's very interested in interstitial cystitis, which is low-grade, grumbling, chronic infections of the bladder, he noticed that when he sees all these women with interstitial cystitis, that so many of them have got IBS or fibromyalgia or ME or various other problems. And he pulled it together and said, well, actually, what's going on here is a syndrome called mast cell activation syndrome and histamine intolerance. And so he has done a lot of research and been very interested in it. And he helped us, which was fantastic.
Oh, brilliant.
Getting her on the right treatment. So that was really the first step. Yeah.
How fantastic.
Yeah. But she's pregnant now, actually.
Wow. So her whole life has turned around.
No, she's great. She's just qualified as a nurse, and she's pregnant, expecting a baby in September.
Oh, great.
And that's really great. That shows how healthy she is now, because she had, no fertility issues, and she's got a normal pregnancy, and that's all fantastic.
Oh, that's great. And interesting side note, only for those who are most geeky about histamine intolerance, apparently women, when they're pregnant, often create loads more of the DAO or DAO, and therefore don't get the histamine intolerance symptoms.
It cures it. Yeah. So it actually makes you increase the amount of diamine oxidase that you make by 500-fold. 500-fold. Now, when Jessie was very, very ill, we did check her diamine oxidase, and it was undetectable in her blood. It was less than 2, which meant they couldn't see any. And the normal level is 30 to 60.
Right.
6 months later, when we had calmed everything down, her level had gone up to 23. But she still, had to be careful about what she ate and couldn't eat histamine foods and so on, and was on antihistamines and a mast cell stabilizer by then. But I suspect if we did her diamine oxidase now, it would be really, really high. Yeah. And she's feeling so well, it's fantastic. So she's not on any of the medication that she was having to take just prior to the pregnancy, because it cures it. But you can't be pregnant the whole time, unfortunately.
No. I wonder if in future there's a treatment probably for women that would mimic, for those very serious histamine intolerance stuff, that would mimic pregnancy.
Well, that would be fantastic. I mean, we know that the combined pill does, doesn't it? It stops ovulation because it makes your body think that you're pregnant. So it stops you basically, but it doesn't have the effect of making the diamine oxidase, unfortunately. But you're right. Yeah. You're right. I have also dreams about some kind of saliva test or something that we could do, which would show people what their level of diamine oxidase is on that particular day. So they would know whether they could get away with having something which is a bit higher in histamine to eat or not. Yeah, well,
that's a good point. I've just been recording another interview, and I was chatting to I'm going to Heston Blumenthal's restaurant tonight. Which I'm very excited about, especially after the last 6 months of lockdown. Yes. But I should have thought there'll be some histamine in there.
I'm sure they will. Have you got some DAO?
Yes, I have. Yeah.
Good.
Yeah.
Have you got some Toxoprevent?
No, what's that?
Now Toxoprevent is a very interesting substance. It's made from volcanic powder, volcanic rock, and it's called a zeolite. It's a massively complex molecule, huge molecule, and in the middle of the molecule, a bit like a black hole in outer space, there is this black hole, and it attracts poisons out of the body and histamine into the black hole. Wow. So if you have a couple of those with your diamine oxidase before your DAO or Daosin or whatever, which one you're taking, before a meal, say 10, 20 minutes before the meal, then it doesn't get absorbed into the bloodstream, but it passes through the gut and it absorbs as much histamine and heavy metals out of your liver, in fact, incredible, even though it's not absorbed, and clears them out of your system.
That is amazing.
That can be very helpful.
Yeah. I think I took some zeolite a few years ago, and I did find it made me feel great, although it did make me feel very dehydrated. But that is something I'm going to look into again. Thank you so much for that. That's amazing.
it's worth trying.
I mean,
Yeah.
I wonder, in terms of the future of histamine intolerance, I mean, obviously there should be an underlying reason why someone is histamine intolerant, shouldn't there? You know, whether it's genetics, whether it's a problem with the gut, whether it's environmental.
Yeah.
And I think that's, you know, for me, long term, it's figuring out, well, hang on, why can't I eat chocolate? You know?
Well, it's very interesting you should say that, Tony, because this time last year, I felt that we'd helped Jessie to get to a certain level of better health, but we hadn't cracked it. And so I wanted to know her genetics. And I researched various different companies to see which one would be the best one to go with. And the best one that I found was one called Life Code GX.
Okay.
And we had her methylation, her histamine, her estrogen, and in fact, I think we had virtually all of her pathways calculated. And you can look at your genetic makeup for how you metabolize histamine. And lo and behold, she doesn't make diamine oxidase very well. So
right.
there are, and also she doesn't make the other enzyme that breaks down histamine called HNMT down that pathway. So there are two pathways that break down your histamine. And she's got genetic variants, which mean that she doesn't do either very efficiently. So therefore, it's very easy for people who have that kind of genetic makeup to be overwhelmed by histamine. Now, about 10 to 20% of the population have those particular genetic variants. And therefore, there's quite a lot of people out there walking around with our modern diets and, you know, having far too much histamine, much more than their bodies can cope with. So we're drinking we're drinking a lot of histamine, diamine oxidase blockers. So alcohol, which you found as a teenager, blocks your diamine oxidase.
Not just a teenager, Tina, but
not just a teenager. Okay. And so,
I'm really in moderation now because I can't hack it otherwise. But
well, there's something called the wand you can buy. And
I've tried it; it doesn't really work.
Doesn't it work for you?
No, gutting.
Stick to the gin then. Stick to the gin.
Yeah, rum seems to be okay, actually. Funnily enough.
Oh, rum does it?
Wine really does hit me hard.
No, wine is no good. Yeah. But so there are certain drinks like alcohol, like tea, any tea, like coffee, any coffee, even decaffeinated, green tea, which we're all drinking a lot of, and they block diamine oxidase. So if you're a poor diamine oxidase producer, and then you block it, what little you make, you're going to come unstuck and you're going to get histamine issues. I also believe, actually, even somebody who produces the right amount of diamine oxidase, if they have a sufficiently high histamine diet, they can get into drug difficulties. But with them, it's easier to mend because you sort out the too much intake, the high intake and the blockers, and then everything should be fine. But, you know, people are having TV dinners, they're having leftovers, they're having takeaways, they're having processed foods, you know, and all of these things are really, really high in histamine. So if your body can't cope with it, you're going to start to get symptoms of IBS, maybe headaches, maybe anxiety, insomnia, brain fog, itchy hives, swellings, feeling bloated, you know, all of that.
All of those,
All of those, yeah.
And no, it's funny you should say that. I was just this guy I was chatting to beforehand. He runs a continuous glucose monitoring company. And he started off the interview by saying, look, I'm really sorry, but I've got a few allergies at the moment. And then he was telling me about how when he goes to a very expensive sushi restaurant, his glucose scores seem to be quite good. But when he goes to the sort of local buffet and all the sushi's been sitting out there for a while, it's not going to treat him so well. And I said, well, it's funny that you mentioned allergies earlier on, because actually fish is very high histamine and supposedly can double in histamine values every 20 minutes. So if it's been sitting there all day, it's not going to be good for you for your allergies either.
No, it's apparently it's the bacteria in the gut of the fish. So the fish per se is generally low histamine or no histamine. But as soon as a fish dies, the bacteria in the gut of the fish starts to double every 20 minutes. They double in quantity, they're rapidly reproducing, and they make a lot of histamine and they pass that through into the tissue of the fish. So if you're eating anything, as you say, that's been sitting around or hasn't been killed and gutted and frozen immediately, then it's going to be high in histamine. So not great.
Yeah, There's a company that sells fish on Ocado though, which is frozen, and it is absolutely delicious, frozen salmon. So that's good for me.
Absolutely, and that's this kind of thing that people with histamine issues need to know.
Yeah,
you know,
it is
there's that,
yeah.
and there's a coffee called Purity Coffee, which is only available online, and that has the lowest amount of problems, and also mold-free coffee, because it's the mold on the coffee that, you know, is often the issue. So, and the other thing is to watch out that you don't live in a moldy house.
Yeah, that's harder to measure. I have tried to measure it, but it's quite difficult to measure. But no, as you say, I'm drinking a coffee right now. It's a Mindful coffee, another brand sold on Amazon, which is low mold. But as you can tell, I mean, I'm really deep in this stuff, you know, and I'm really passionate about sort of rooting out the information. I've got no medical skill, but I do fancy myself as a journalist in getting this information out there. And I think one of the frustrations for me is a bit like your daughter, you know, I think that it's so much better, but I still have to watch it pretty carefully.
Yeah.
And I suppose it's one of those things that probably you'll always have to be vigilant of. Do you think it's possible for people to completely cure themselves of histamine intolerance? Or is it always something you're going to have to be, all right, one slice of chocolate rather than 6 sort of thing?
Yeah, I think that there are different groups, actually. I think you've got... and this is just my understanding of it, and it's a very new science, really. So we're still, there's an awful lot to learn. But I think there are a group of people who have normal mast cells, normal histamine metabolism, but overdo it on the histamine. So they can adjust their diet, be a bit more careful, be mindful of what they're eating and not eating, and they probably can be completely back to normal, but just not overdo it. As you say, don't have the whole box of chocolates.
Yes.
Just have 1 or 2, and don't do that if you're already, you know, have had a lot of wine with your meal and you've had sushi and fish and blah blah blah. So there's that group, and then there's the group of people who have poor histamine metabolism. And they're going to have to watch it a little bit more, or maybe take some antihistamines on a regular basis, or to help them. And then you've got the group who have got slightly abnormal mast cells. Now, if you've got slightly abnormal mast cells, they are overreactive to the environment, and they are constantly releasing histamine. So you've got this internal production of histamine going on, and that is that you have to calm down with mast cell stabilizers, and maybe taking some antihistamines if you can feel that your histamine is getting a bit high. So that might be intermittently, and you might also have to be a bit careful with your diet. I think there's another group where they're poor histamine metabolizers. They've allowed their histamine to get very high. That has irritated their mast cells, which have then added to this party of histamine. And so actually, that group, you can calm those mast cells down. They're not going to be long-term aggravated mast cells. Does that make sense?
Yeah, it does.
A few different subcategories, really.
Yeah. Maybe I'm in that last subcategory. It's very interesting, and it's certainly, I think it's quite helpful to be finely attuned to what works for you. You know, for example, you know, you mentioned supplements and antihistamines. I've found that vitamin C works very well, actually, probably the best antihistamine for me, along with quercetin and magnesium as well. I find works very well. Yeah. Just a really good magnesium supplement helps me feel less dehydrated and in general. Yeah. And a lot of trial and error as well.
Yes. And to see I suspect, Tony, if we did your genetics, then we would see that you've got some methylation issues. Yes. Probably, because all these patients do. They all have methylation issues. And taking some good vitamins and supplements and adjustments in the diet to make sure you're getting the right nutrition can make a huge difference. So with Jessie, we did her genetics. We then knew, even though she was on a whole load of supplements already, we were then able to fill the gaps where we didn't realize she had a problem with, you know, needing more zinc or whatever it might be. So we gave her a few more. And one of them that made a big difference to her was SAMe, which is energy for the cells, makes energy, you know, and is a sort of a universal methyl donor used in so many of the body's metabolic processes and biochemical processes. And she found taking that gave her much more energy, because we realized she didn't make it very well in her liver. Anyway, so I've slightly lost my train of thought. Oh, so yeah. So actually, knowing about the genetics can be incredibly helpful, and working with a good nutritional therapist, somebody who understands the genomics and the nutrition, can be hugely helpful. And Jessie then found she just felt better and better and better and better.
Great.
So much so that she could actually tolerate some histamine foods that she hadn't eaten for maybe a decade.
Really?
Absolutely.
Wow.
And couldn't eat them every day, couldn't eat all of them all the time, but could have the occasional bowl of strawberries or, whatever, and didn't feel immediately ill and struggle for a few days or weeks afterwards. We'd also turned it around. So instead of feeling unwell all the time and having the odd afternoon, maybe twice a month when she felt better, it became the other way around. She felt better all the time with the odd morning or afternoon when she felt a bit headachy, and then she knew her histamine was running a bit high.
That is absolutely fantastic.
Yeah, she hasn't had to take all the medication all the time either. She was
great. Yeah,
it's really, really significant.
Wow, what a difference to her life. I mean, just fantastic. And I have to say, a difference to my life as well. That's certainly I have done some testing, and my methylation was appalling, and I could barely tolerate the tiniest amount of a methylation supplement, and now I can swallow them all and I feel fine. And also I can just feel in my body I'm less inflamed, this, that, and the other. It's a big difference. So it is fantastic. And I think long term, you do want to be able to occasionally have those treats, or not worry if you go around someone's house and you think, oh my God, did they cook that yesterday? Or, because otherwise it's just too stressful, isn't it? So
it is. And you have to enjoy your life and get on, be able to socialize and do all these things and not feel left out. So it's really important.
Oh, it's
but we're learning more and more. And I think, this long COVID is going to put mast cell activation on the map. And I've been hearing a few frustrations from some patients who have got mast cell activation, who have had decades of not being able to find somebody to help them or recognize what's going on. And they're now saying, now people have got long COVID. The NHS is setting up long COVID clinics, but they've ignored my condition and our condition for decades. But I have a feeling there's going to be a silver lining for everybody, because the long COVID seems to be maybe affecting the mast cells, and there's a cytokine storm, and the symptoms are the same, and the treatment is the same. So we're going to have clinical teams who understand this and are trained in this, who can set up centers of excellence which will treat people with long COVID and mast cell activation and fibromyalgia and chronic fatigue and chronic headaches and urticaria and food intolerances and everything, because it'll all come under the same umbrella.
Are you running a histamine intolerance and mast cell clinic now as such?
Well, I'm running in theory I have a long COVID clinic. I've come out of the NHS at the moment, and I am running a private clinic called the Menopause Consultancy, and that's really specialising in women's menopausal issues and treating the menopause. And but because of my interest with my daughter, over the last 6 years, I've treated hundreds of patients with mast cell activation. And of course, some patients who are menopausal have mast cell activation. So it's about 17% of the population. So it's going to be about 17% of my patients who I'm going to recognise this in and treat it. And actually with HRT, it's very important that you address both, because if you just address the HRT and just give them hormonal therapy, often they feel worse because the histamine and estrogen are interrelated. And if their histamine is high, they're never going to settle on their estrogen dose, and they're going to have symptoms which are very similar to not enough estrogen, but actually giving them more is going to make them worse. So it's quite complex. So it's very important to understand and tackle that when you're running a menopause clinic. So I'm seeing a group of people, and then some women would sneak into my clinic who weren't menopausal at all, but had mast cell activation, but they just knew that and of course, when they come up in my diary, I just don't know why they're there, and then find out they're mast cell patients. But I became very interested in long COVID last summer when I started hearing the symptoms that people were describing, and I thought, my gosh, they sound just like my mast cell patients. I think that it's mast cell driven. And so I went on BBC Look East, actually, and asked on the news if patients with long COVID would mind downloading a free app called People With, and that's written as one word. And they could download the app and they could record all their symptoms and track them. And that would give me an opportunity to see if I was right, if my theory was, if the profile did look the same. And 2,000 people downloaded it.
Wow.
Which is fantastic. And now I think 8,000 people have downloaded it with long COVID. And they're recording and tracking their symptoms, and they absolutely do fit with mast cell activation. So then I started thinking, well, if I need to talk to some of these people, because I want to know, did they have evidence of mast cell activation before they had the coronavirus, or has the coronavirus stimulated and caused the mast cell activation? And I also thought, I think I know how to maybe help some of these people. And the reports were coming out of patients not getting any help anywhere, and the Royal College of GPs produced a living guideline, and unfortunately it doesn't say any treatment, apart from listen to your patient and tell them to pace themselves with exercise. There was no constructive medication to give these patients. So I felt obliged morally, actually, to open a clinic. And so I could only spare one morning a week. So I opened a clinic on the 1st of November, and within about 36 hours, it was fully booked up until the end of March.
Wow.
Which was how long I just put it in my diary for,
Yeah.
So then I sort of slightly panicked and thought, well, I need to have time to follow up on these patients. I have a duty of care. I can't just keep taking on new and see new patients all the time.
Yes.
So I had to close the clinic, unfortunately, to newcomers.
Yeah.
But we do have a waiting list. And I'm hoping in the next few weeks, I'm going to have another doctor join me who will be trained and happy to see these patients and work with them. So, and, once I started talking to them, I've spoken to now about 70 long COVID patients. They absolutely, all of them except 2, have got a previous history suggestive of some kind of histamine intolerance or mast cell activation prior to catching the coronavirus. And they've just behaved in a typical way that somebody with these issues does behave when they get a viral illness or an infection. They always get much worse from their mast cells. Yeah.
That is fascinating, because the reason that I do this podcast is I contracted a virus in 2014. And it was in the Philippines in the jungle. And in fact, the sort of specialist doctors that I saw, they knew that I'd had a virus, but they didn't know what it was. But I had some real complicated post-viral symptoms, which meant I had to take 3 months off work. And of course, when I've been hearing about the symptoms of long COVID, they have made me think of my own experience, because it seems quite similar to a lot of people. And I very much sympathize, because it took a long time to get over. Yeah. And it changed my life forever, actually, although it certainly made me sort of clean up my life.
Yeah.
Very interesting.
That is interesting, because what you're describing is what I would have expected you to experience if you had a nasty infection, because of your previous history of mast cell problems and histamine issues. Yeah. So you were behaving in exactly the right way, if you like, for somebody with that profile. And I think the coronavirus is just particularly irritating to the mast cells. And we know now that there is viral debris going on, persisting in people's systems. And we think that one of the theories is that the viral debris from the coronavirus is constantly irritating those mast cells. So you're still getting your cytokine storm, you're still getting the overproduction of histamine. And that's affecting and causing inflammation, which grumbles on and on and on in the body.
Yeah. And hopefully, now that I've sort of dealt with that histamine intolerance, viral infections will have a very different and lesser impact. That's the hope, anyway.
Yeah, I hope so. I hope so. And I think that should be the case.
Yeah. Well, thank you so much for all the work you're doing. And I've sort of learned so much from you today. And I'm definitely going to be buying, what was it called? Toxoprevent?
Toxoprevent.
It sounds like something you'd put down to get rid of rats in the home, but well, that sounds excellent.
Yeah, no, it is good. It is good. And the last thing I'm doing is I'm trying to trial Ivamectin, treating patients with Ivamectin who have long COVID. I was recently on a Zoom call with some leading lights in treating long COVID globally. And we were trying to put together a protocol because we feel that this is what is needed. There needs to be, a proper protocol for people to follow. So that's for all the GPs and everyone who's coming across this condition.
Yeah.
There are literally millions of people across the world with long COVID. It's estimated between 10 and 30% of patients who've had the coronavirus will get long COVID.
Yeah.
So it's a large proportion of the patients. So we were trying to we've put this protocol together, and one of the treatments that's recommended is Ivamectin, which is an antiviral, antiparasitic, mast cell stabilizer, anti-inflammatory drug that's been safely used for the last 30 years or more in lots of parts of the tropics and parts of the world, and is being used in many parts of the world for prophylaxis against coronavirus, and also for treatment of acute coronavirus and for treatment of long COVID. So I'm starting to trial that with my patients, and certainly the responses have been very good.
Great. Wow. Yeah. That is so exciting, isn't it?
It is exciting.
Because it's quite cutting edge, actually, isn't it? And, it's so topical and so many people have been affected. And,
yes,
and here you are right in the centre of it. It's brilliant.
I suppose it is, actually. I've organised a conference, which is going to be the 19th and 20th of June, on how can we treat long COVID, because I felt that there are so many medics out there, healthcare professionals, some of whom are doing what I'm doing and are finding some progress for their patients and improvements, and others who are really struggling to find anything and to learn about it. So I thought we need an international conference to just put it out there. So it's going to be the 19th and 20th of June. And hopefully it's all be on Zoom. So I've got some fantastic speakers coming.
Oh, brilliant.
Brilliant, yeah.
If you want to optimize and biohack and be at your best, it is worth doing some detailed health testing. Just interrupting this podcast for one moment to remind you that today's podcast partners are a company that can help you do all of that at home. And it is a company I've been trying out, InsideTracker, an ultra-personalized performance system that analyzes data from your blood and your DNA and your lifestyle and your fitness tracker to help you optimize your body and reach your health and wellness goals. And I've been doing it. And what about my results? Very interestingly, one of my blood markers came back well outside range. I did the test, InsideTracker sent it through the post, took about 3 minutes to do the blood test and send it back. And now their interactive system online is helping me to make some detailed changes. And that is great. And it's just something that I wouldn't have known about, that marker, unless I'd taken the test. You can even upload your DNA results to the portal too for extra insights. Very, very impressive. And you know that I love tracking on this podcast. I'm a big fan of tracking. So you can visit InsideTracker.com/zestology for a big discount. InsideTracker.com/zestology for a big discount, 25% off. When you go there, you'll see a cheesy picture of me as well. And, I think if you want to add years to your life and more life to your years, this is the way to go. You have to know what's going well and what you could optimize. And for me, already, I'm getting these results with InsideTracker that is making quite a difference. And the other thing is, a lot of people say to me, look, I'd love to get tests, but it's too expensive and it's too complicated. And this is not that expensive, and you can do it all at home as well. InsideTracker.com/zestology for 25% off. Now back to the show. From my own perspective, I suppose the first thing that really started to help me heal was actually emotional freedom therapy. Just because I'd sort of got so tense about my symptoms and about the fact I wasn't going to get back to health. And I bet your daughter had the same sort of thing. I mean, it's just so emotionally draining as well, feeling like that all the time, to see someone who is really good in that and specialized in fatigue as well. I mean, it was just like this massive release. And then from there, I started to heal. So
that's a brilliant point, actually, Tony, because one of the things that I encourage all my patients to do is the Gupta program or similar neuro, sort of retraining of the brain kind of program. And sometimes, Facebook groups and things can be incredibly helpful and supportive, but also sometimes they can be very worrying because you hear about other people who are really very, very sick. And then you think, oh my gosh, I'm going to become like that. And so whilst they have their place and they're hugely supportive for people, sometimes it just makes people very anxious and can make them more anxious. And having something like the retraining of the amygdala and the insular parts of the brain, which are on high alert, red alert the whole time, can be massively helpful. So I've been recommending that to my patients and having some very, very good results with it. And I think the two together, as you say, the awareness and understanding your condition, the avoiding the big triggers if you can, as much as you can, some medication as and when is necessary, and the psychological retraining of the brain, all together, it takes all of that, because we are complex, aren't we?
Yeah, we certainly are. Yeah. Now, something that I've asked everyone, I didn't prep you on this question in advance, but I ask everyone for a book that they would recommend and a tip for living with more energy and vitality, because that's what I didn't have after I went to the jungle and contracted this virus and had to spend 3 months in bed. So that's why this podcast sort of focuses on energy.
Oh, gosh.
What is one book that's had an impact on you? It doesn't have to be a medical tome. It could be fiction. It could be anything you've read recently. What would you recommend?
Okay, well, I'm actually going to recommend this one. Because it's called Estrogen Matters.
Okay.
And it's by Dr. Avram Bluming and Carol Tavris. And estrogen is very, very misunderstood. And I see so many women for HRT who have been under the impression that estrogen is very dangerous and that they should avoid HRT at all costs. And therefore, some of them have put up with a miserable existence for years and years because they've been trying to avoid what could actually make them feel much better.
Right. Wow.
And also there are a lot, because people worry about estrogen causing breast cancer. That's the big issue for them. And actually a lot of it all needs to be looked at in context. And one needs to understand that different HRTs are different, that not all HRTs have the same side effects and risks, and that with all of them, though, it is safer to be on HRT than it is to be off it.
Right.
So, so even in the trials of old-fashioned HRTs, which had a bigger impact potentially on the breast, even in those trials and studies, the placebo groups were more likely to die and have diseases than the people on the HRT.
How extraordinary.
Okay, because HRT is so protective.
Yeah.
And I think that if I was going to ask people, women especially, to read something, it's to read Estrogen Matters.
Yeah.
By Dr. Avram Bluming, he's an oncologist who was treating women for breast cancer. And he would always say to them when they'd come to see him, because nowadays, we're getting so much better, so much better at detecting breast cancer and treating it and curing it. And he would have women come back 10 years after their breast cancer and say, you cured me of breast cancer, it's great, but I feel absolutely miserable now because I'm having the menopause and I just can't function properly. And he would say, oh, you should be grateful. We saved your life. Go away and get on with it. Be a grown up, stop making a fuss. And of course, these poor women weren't making a fuss, because actually, if your hormones, the lack of hormones can affect you in very dramatic ways, so that you become a shadow of your former self and you can't function properly at all. And you start to lose who you are and how you behave and how you think and how you feel and everything. And it can be very, very alarming. And anyway, so then his wife got breast cancer. And he watched her go through the menopause, and she said, I need HRT. I can't bear this. So he said, right, I'm steeped in the studies already. I'm going to write a book. I'm going to pull it all together for women to see whether it's dangerous for them to go on HRT or not. And for this group of women who've had breast cancer already, to see what is the evidence out there that going on HRT for them is a bad or a good thing. And so he wrote the book, and it's been life-changing for millions of women, I would say, across the world. And it's something every doctor should read as well.
Great, yeah.
Because, there are all sorts of myths out there about not staying on it for longer than 5 years and, not being able to take it at all if you've had an early breast cancer that's been cured and it's gone and all this sort of thing. So it's really very, very important information in that book.
Oh, interesting. Funnily enough, my wife was saying to me the other day, she said, "Dad, I'm not looking forward to the menopause much. I've heard a lot of stories from my friends recently about that." So I'll tell her about the book.
Yes, there is no reason for women. I have women. I put women on HRT every single day, and my oldest lady on HRT is 91, and she is fit and healthy. There is no reason to stop taking it unless unless you've got a breast cancer and that you're told you must stop it for now because it's estrogen receptor positive. So cancers are the only reason why you might have to stop it. But otherwise, women carry on taking it and they stay fit and healthy, and they should take it to their grave, really.
Wow. Okay. What about one tip for living with more energy and vitality, or is that it?
I suppose if you're going to the menopause, please speak to a specialist and get the right information, and try HRT and go for it. That is one tip. Another tip is to stay positive no matter what. I think you just have to. Life throws all sorts of things at all of us, doesn't it?
Yeah.
And you can deal with everything much better, in a much better way, more efficiently. Unless everything's less traumatizing, if you can try and be as positive as possible and look for the silver lining and have an inner belief that things usually happen for the best, and try and find some silver lining. And I know, that's not always easy to find in certain situations. And I can think of situations where I wouldn't be able to find it at all. But I've had breast cancer twice myself, and one of the best bits of advice I was given was by the lovely lady in the X-ray department when I went along and had a mammogram and could see it there, and it was sort of confirmed our worst fears. And she said to me, "Look," she said, "everyone who has this diagnosis, who's positive, does much better than people who have the diagnosis and are totally overwhelmed by it and don't think positively. So if you think positively, you're going to do better and are more likely to be cured and do well." And so I absolutely clung on to that and thought, right, she's right. Best foot forward, dig deep, and keep smiling, and it's all going to be all right. And actually it has been. So.
Yeah, good. Yeah, that I'm sure that is very, very true. Well, thank you so much for everything that you've spoken about today. It's such a quest of mine to seek out the best histamine intolerance information, and it's just so refreshing to speak to someone with such a high level of expertise who knows so much about it. And as you can tell, I know quite a bit about it as well, but based on my own personal experience mainly. So it's great to talk to you, and I really appreciate it.
You do. And Tony, thank you so much for doing what you're doing, because people do listen to you, and it's such a fantastic way of getting the information out for people to, probably they will know more about it than some of their doctors, but hopefully that will change.
Well, definitely. Yeah. I've got this histamine intolerance Instagram now, and the amount of stuff I've learned just from there, from people telling me about the coffee they drink and, that sort of thing. It's just great.
I'll have to look that up.
Yeah, please do. Yeah, you'll sort of find all sorts of witterings from me about various things. And I think I was posting recently, I seem to wake up earlier in spring when there's more hay fever around. So I'm sure that sort of pushes up the histamine a little bit. Yeah. So that all these things are interlinked. But anyway, that's enough. Where can people find out more about your various clinics and everything that you do?
Well, I've got two websites. I've got drtinapeers.com. And I've also got menopauseconsultancy.co.uk. Because my menopause work, I also have some associate doctors working with me. I've got 5 doctors, because the demand was so huge, I couldn't cope with it on my own. And I felt I needed to expand and have more like-minded doctors who I could mentor, and who would, give the same kind of care that I give. And I'm very privileged and lucky to be able to do that. And I know there are now there's 6 of us in the clinic. I'm hoping another doctor is going to come who will help with the long COVID patients. And he's hopefully going to start in a few weeks' time. So that will be helpful. So people can look there. And I've also got an Instagram, which is called Menopause Consultancy. And that's just to put out information about HRT and the menopause for women to read at their leisure. For our conference, it's on a website called treatlongcovid.com, which is PLC.
Yeah, fantastic. Yeah. I will be very, very interested in that myself. So I'll definitely take a look at that.
Great.
Lovely. So good to talk to you. Thank you for coming on Zestology.
Thank you very much for inviting me.
That is it for this week's Zestology. And a quick reminder that our podcast sponsor this week, our podcast partner, should I say, is InsideTracker. And in fact, I've had a lot of the histamine intolerance lot get involved in this one, because one thing that we all really want to do if we want to optimize our health is get involved with tracking. And InsideTracker is something you can do at home. You know, a lot of people say to me it's really expensive to track your health, to get some detailed measurements. And I think that's why I think InsideTracker is so good, because it's not expensive. I mean, you compare, I'm working with a practitioner at the moment. She's absolutely brilliant, but it is very, very expensive. And InsideTracker is very affordable, and you get a lot of the same metrics. And then they help you through every step of the process. I think there's room for both. I think there's room for InsideTracker and working with a practitioner as well. But, you know, the thing about InsideTracker is it's science-based recommendations for a positive diet, for lifestyle changes, progress every day, every step of the way towards reaching your performance goals, and living a longer, healthier life as well. So you can go to insidetracker.com/zestology. You will save 25% when you sign up there. It's insidetracker.com/zestology. And as I say, a lot of the histamine intolerant lot have been getting involved with this because they in particular appreciate the benefit of having some metrics by which you can track your improvement by. That's it for this week's Zestology. I'm off for a bit of CBD, taken the conventional way. See you next week.